Hi everyone. I hope you've had a good day. Just wait. I've just asked Fatima to join me, so I'm just gonna see whether it'll come up now. So excited today actually because Fatima is not only a dear friend, she's an amazingly talented young lady, and I'm sure that a lot of us will find her very inspiring. So hopefully it'll work. Let's see if I'll try it again. I have invited her. No, she's unable to join. Let's see. So Fatima, invite. I'm also waiting for Unsuman. He may join us tonight, he may not. Let me just check. I think I've had a message. To Instagram, I have sent you an invite for joining. Maybe that might help. I don't know whether you're able to go onto Instagram. Sorry guys, I'm just going to pause the live a second. There we go. If I try and invite you again, have you had a message? Hello, Mariam. Oh, she's unable to join. Okay, if anyone has ideas, tell me. I think this is the only way I know. Fatima, you know when you join, does it give you an option to request to join the live, or because I have invited you, so maybe it has to be that way. Let me see. Sorry guys again. It's really weird. Okay. Sorry. She can request to join. Yeah. Fatima, does it say you can request to join, or because you can just press that and I'll let you in? This is the first time we're doing, Fatima's doing this, and you know, even with me and Ansuma, we have these teething problems in the beginning of the live, so it's understandable. Fatima, invite, keep inviting her. That's so strange. Shall I come out of the live and start again? What do you guys reckon? And maybe do like a little... No worries, totally understandable. Shall I come out of the live, Fatima, and then just text me, and then I'll rejoin, and then we'll start again. Because I want this. Okay. I'm going to come out, guys, and then I'm going to restart. Okay, and then we'll just start. Oh no, there she is. Assalamu alaikum. So what was happening? It was just saying that it was expired.
I'm not sure. Every time I try to click on it, say like your invitation expired. So,
oh God, I don't know what's going on there.
really?
Yeah. Yeah, I can see you clearly and everything. I can hear you okay. Yes, all good. Oh, thank you so much for agreeing to do this, because I think a lot of people will be inspired by how you manage so many things in your life, along with your job, your family, and you're just an inspirational person. So I think a lot of people will benefit.
Not about all of this, but no, I'm glad.
And modest on top of that as well. Mashallah. So, do you want to introduce yourself to those who may not know you? I know a lot of people do probably know you, but just introduce yourself.
My name is Fatima Elgizawy. I'm a GP in Stoke-on-Trent in North Staffordshire, and I am a GP trainer and a training program director for North Staffordshire GP training vocational scheme.
Fantastic. Wow. And I mean, I made it a point to put all your qualifications on because I'm just so like, wow, you've done so much since you qualified as a doctor. And you've had 2 children as well, so it's not been easy. Tell me, what made you choose general practice?
Well, where to start? Well, general practice, the thing I always liked about general practice is the variety. I was that kind of student, medical student, and a doctor who literally enjoyed every single placement they've done.
Yeah.
I enjoyed pediatrics, I loved obs and gynae, I loved surgery, I loved medicine. So I was always that kind of SHO that enjoyed every single placement. And general practice offers that. It offers you the chance to be exposed to every single specialty in medicine. And I like the idea about being a family doctor, where you kind of provide care to everybody in the family, like from cradle to grave, they say. So that was the first thing that appealed to me in general practice. On the personal side of things as well, general practice for me offered a lot of flexibility in terms of working hours. That was appealing for me in terms of trying to establish this balance between your family and like having a young family and work. So that was another reason I really went for general practice. I bet it's the reason majority of us as GPs would choose general practice for these 2 reasons, isn't it?
Absolutely, I totally agree with that, because you're exposed, like you said, general practice has the ability to expose you and involve you in all specialties, no matter what they are. Your day is never the same. Like, you know, it's so varied.
Walk through your door. So
exactly. So when did you start GP training? And did you stay in one place, or were you in Stoke for that?
So yeah, so I initially had after I've finished my foundation training in Egypt. So I actually qualified from the UK. So I qualified from an Egyptian university. So I finished my foundation training in Egypt, and then we have to go through something like a medical licensing exam. EMC registration and licensing, so to get like the license to practice medicine in the UK. So I finished this after finishing my foundation training in Egypt, and interestingly I had a CT1 job post in surgery.
Wow, oh my goodness.
And sort of making the decision after 3 months to apply for general practice. Although I love surgery, I really love being I love the surgical work, but for me, general practice was more kind of convenient and appealing for me to apply. So I applied for general practice, and I was lucky that sort of I was allocated a post in Stoke-on-Trent, and I didn't have to rotate. It was all in the same place with different specialties, all the same geographical area. So that was another convenience.
Yeah. And which were you in Royal Stoke for your hospital placements then?
So yes, so I had in my days of training, we had 6 months, like 6 monthly rotations, where you have 18 months in hospital and 18 months in general practice. I think it's changed a little bit now for the current trainees, where they have 4 monthly placements and they would get more general practice exposure. So I had, they have more general, like 4 monthly placements, so they get extra 2 months now in general practice compared to before. Two months per year. But for me, I had cardiology, psychiatry, and obstetric and gynecology. So three different specialties, but the 3 are equally useful.
Absolutely. I mean, did you have a peds job then? You didn't have a peds job when you were
doing...
No,
I didn't have a pediatrics job, but I felt that with the 18 months of training in general practice, it kind of helped me cover the pediatric side of things. Especially out of So you do see a lot of kind of acutely unwell children. So this helped kind of build my experience in pediatrics, although I didn't work in pediatrics.
Yeah. No, that's really good to know, because some people don't get a peds job or don't get an obs and gynae job, and it's important for them to know that actually general practice, when you're doing your placements there, you do cover what's relevant for general practice when you're doing the job. So yeah, absolutely. Oh wow. And so you did those placements, and I guess, when did you actually qualify then as a GP? I just want to ask that
So
question first.
yeah, so let's start from the beginning. Let's take you
Yeah.
back. So I had the 18 months of hospital placements, and then I've got 6 months of GP, and I had a maternity leave between ST2 and ST3. So and
Okay.
then I return as part-time, because I obviously had a young baby back then. So that's
Yeah.
another thing about the flexibility of working less than full-time was really helpful. So I only worked 4 days a week. So I qualified 2018. So that's
Yeah.
December 2018 was when I gained my CCT, or certificate of completion of training.
That's fantastic. And then when you finished your training, did you have any thoughts before you finished what you were going to do with, once you qualified?
So during my training itself, I started actually to develop the special interest. So as an ST1, I always had special interest in women's health and obstetrics and gynecology, and that was the reason actually when we were given the choice to pick the third rotation, I picked obstetrics and gynecology, because I kind of like women's health, and I thought like that will
Yeah.
be a field I can give in. So I finished my DRCUG on the first year of the training. So as an ST1, I applied for the
Yeah.
DRCUG and
Yeah.
exam, which really helped me, to be honest, with sitting the GP exams afterwards, because you've got a big branch of the obstetrics and gynecology well
Fantastic.
covered, knowledge
Yeah.
side.
Yeah.
And again, during my training years, I was determined on the side of medical education. So I didn't have the medical education certificate back then, but I had what's called the medical sciences certificate, and it was based in Kiel, and it was
Oh,
mainly
right.
tailored general practitioners. So it
Yeah.
was communication skills for health professionals, medical ethics and law, statistics, clinical effectiveness,
Yeah.
and kind of practice, leadership and management. So all of these things really did help kind of
Yeah.
tailor your choices.
Yeah.
So by the time I finished training, I was more towards definitely medical education and women's health. And that's how I
Yeah.
ended up
So
where I
you
am.
did from what I remember, you were doing the PG cert before you qualified as a GP, isn't it?
So
You'd
I've done.
started it, or you'd.
So I have the PG cert in medical sciences. I finished that during my training, but I have applied
Yeah.
for the medical education one after I finished my training, because I was lucky that we had a scheme locally in North Staffordshire where they would
Yeah.
support newly qualified GPs for postgraduate qualifications. So that's how I applied
Fantastic.
for
Is
the
it?
post qualification of like postgraduate certificate of medical education.
Yeah. Is that the federation that does that?
Yeah, that's the GP Federation. It was through the GP Federation. So we were lucky, like sort of many of us went for medical education. Some went for the dermatology diploma. Some went for the pediatrics diploma and ENT diploma. So the GP Federation was supporting within the first 2 years after qualification to gain an extra postgraduate qualification to
Wow.
kind of GPs locally.
Yeah. How did you manage all of that? Like, with your children, and, was it difficult, would you say?
I would say I didn't do this all at one go. So I found what really helped is to try and set a goal or an aim for kind of 18 months or 12 months period, and take it a day at a time, really. I think looking back
Yeah.
at some point, definitely overwhelming, but just keep going. Just what you would just set a goal and just say, I'll just get this module done and then I'll see what I will do with the following one. And this is how it's just sort of, you manage to keep going.
Yeah.
I was like, I have to admit, like, sort of try to spread out your work. Don't decide I'm going to do all of this in this year. It's going to be impossible, and you will get overwhelmed and will give up.
Yeah.
But just break it down and take it a week at a time or a month at a time. Set small goals as you go.
Yeah. So that's really, really sound advice for people who are looking to do these diplomas and qualifications. I mean, I would love to do the PG cert, and that's something I'm looking into doing at some point. But then I was thinking, I want to do the diploma in geriatric medicine as well. So I've got to think about what is feasible. Like, should I do that first, or so setting myself a goal.
Yeah, definitely. And the thing is, like, I went as well for the because my interest in women's health, the DRCOG wasn't enough, because I still wanted to go down the route of kind of having family planning clinics set in my practice. So in terms of fitting contraceptive implants and fitting kind of IUDs or coils. So you will. So I had to finish like the diploma of like the FSRH, the diploma of Faculty of Sexual and Reproductive Health. It's quite a long name. To be fill this. So I've done this towards the end of my ST3 year, but I was lucky that I was part-time and I managed to pass my exams early on. So I had a bit of like 8 months towards the end of my GP training where I could focus on this, but others might find it difficult because they focused on their exams. So it really depends on what time you've got and trying to fill it. But if at some point you say I want to do this and that, and then you decide I'm going to apply for this and do with courses and that, you will get overwhelmed. You'll get kind of stuck at some point absolutely. That I don't have time.
Yeah, exactly. And you'll burn out as well, I think,
Yes, absolutely. And it's all knowledge that actually serve your day-to-day work as a GP. So you will find that this will encourage you to keep going, because you feel you've strengthened kind of a weakness maybe or knowledge gap you had. So this kind of makes you encourage you to keep going.
Yeah, absolutely. And I guess in terms, like you've kind of answered the question already, how the qualifications have helped you in day to day. Do you feel that with your roles now being a TPD, I think the internet's gone a bit. I can't hear you, Fatima. Yeah.
Oh, can you hear me now?
Your image is like slowly talking and.
Oh, sorry.
No, don't worry.
I blame today the network have been really patchy. I'm not sure what's going on. Is it better now?
Your I can hear your voice. Your voice is within the normal time, but your picture isn't.
Oh, shall I turn it off and back on, or what do you think?
I don't know actually. How to do it?
Like, am I not moving now, or?
You are. It's sort of very slow.
Okay.
I know. Yeah.
Let me try again. Is that better?
Yeah? Oh, that's a lot better. Yeah.
Okay,
I mean, now you're a TPD. You're a GP trainer as well. It's amazing. These qualifications are probably definitely helping in your role for that.
Absolutely.
Yeah. Go on.
I found definitely the two like the Kiel medical sciences certificate and the postgraduate certificate in medical education really helped in terms of even starting from planning a simple teaching session, how to be like how to engage your trainees, how to be a good clinical supervisor and educational supervisor, how to kind of perform assessments, how to give good kind of critical feedback to your trainees. So definitely have theory, behind all of this really helped.
Yeah.
Obviously, you learn things as you go, and I would say, like, I've just been a TPD now for 8 months, and I've just been signed off as a GP trainer, so I'm in a learning. It's a steep learning curve
Yeah.
for me. But no, definitely the having the knowledge and having the theory behind things does help, like, have a strategy. Let me put it this way.
Yeah,
To difficult.
absolutely.
Yeah.
Yeah, I mean it's a really amazing skill because sometimes you do get trainees in the practice that want to, you to teach them, and if you've got
Mhm.
some knowledge on how to, get your session in order, just having some knowledge of that must be so useful. Like,
Absolutely. And but
yeah,
we have to get that all of us as doctors at some point, you have been a student and a teacher. Because
yeah,
if you think about it, all through your career, you've been in both positions. Because the medical profession, it's kind of pay it forward, isn't it? You learn
yeah,
from your senior and then you teach your junior, and it's kind of a cycle. But I think
yeah,
that the qualifications or the knowledge has helped you refine these skills and polish it up.
yeah,
But it's
yeah.
definitely there, and all of us are kind of teacher by nature.
Yeah, exactly. And I do enjoy that aspect of the job as well, that you get that opportunity to pass on your knowledge and help others learn certain information. And general practice is a great environment to do that because you can teach history taking skills, examination skills, working out what the diagnosis is as well, and management. I do love that part of it.
Yeah, and the mentorship part of general practice is huge. Like, thinking about my own educational supervisor, who's now retired, like, she was
Yeah,
kind of a mentor for me, because it's similar, like apprenticeship general practice. You usually would join it when you've not had that much exposure to it, and you'll find your learning curve, like, kind of going steeply up, 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 because you
yeah,
have to start quickly. So that's the beauty of general practice, really. There is lots of one-to-one time. You get that mentorship support from your educator.
yeah. So now that you've qualified as a trainer, like when do you find out when you're going to get a trainee?
It's usually when, like, I've already, like, from August I have trainees allocated to the practice. So it's because I work in a
Yeah.
practice, so it really depends on the trainees allocated to the practice, and I've got other trainers with me in the same
Okay.
practice. So we kind of each have their own share on um, looking after and training a trainee.
Yeah. And the job that you're doing now, is it a salaried or is it locum?
So
What are
no,
you doing?
I am a salaried GP, but in
Yeah.
our NHS practice. So we are a
Okay.
different practice model compared to other partnership practices. So we are a what we call it, primary care directorate. So we work
Okay.
under the umbrella. So our primary care practice working under the umbrella of the combined healthcare NHS trust. So
Okay.
it's a new model. Um,
Yeah.
General practice.
Yeah. Is it a big practice then that you're working in?
So it is. It is a 17,000 patients register practice. So
How
it's
many? How many?
17,000. So
Wow, that is a large practice, isn't it?
large practice,
Yeah.
but a
And
good training opportunity. So it's
yeah, you got lots to learn, lots to
okay.
gain from patients as well, um, and obviously the series is about why general practice. I think you've covered so much of that. Um, the fact that when you are a GP, you've got this opportunity to gain lots of qualifications in different areas that interest you, and wear different hats. Like you're a TPD, you're a trainer, you're a GP. So that's one of the things I love about general practice, that you can do those things to make your career a bit more like a portfolio career, a bit more, I
Yes,
don't know, what's the word?
the variety to your
The
week.
variety, yeah.
It kind of makes make every week different from the one before. So it's kind of keeps you going, keeps you enjoying
Yeah,
your work. I like this side of training and education because it links you with why you wanted to take medicine in the first place, that initial
yeah,
kind of spark and enthusiasm,
yeah,
with new trainees. So it's it's nice having different hats or different different portfolio career.
Yeah. And let's say, for example, there's someone out there who is considering general practice. They're not quite sure. Advice would you give them if someone's like in the middle? Like, what could you say? I don't know. Just thinking like.
I would say definitely try it. Have taster days. Don't judge a book by its cover. So give it a try. I always say that to students and foundation doctors.
Yeah.
Because you will get, everybody's different, and we all have different we all have different aims, different goals. We enjoy things differently. So don't just say, oh, I don't want to do general practice, I don't want to be away from the hospital. Give it a try. Give it a full taster week and give it a try. That's my only.
Yeah, I mean, the last live we did, we spoke about this, and there are some hospital doctors that haven't done general practice placements because they've never had that exposure, whether they're in F1 or F2, they've just done hospital placements. So it makes it, should all hospital doctors be should it be compulsory for them to have a GP placement?
It's compulsory, for example, now at Keele University that fifth year medical students need to spend 10 weeks in general practice, which I found really good, because even if you go and it's to understand primary care and how does primary care work, I feel it's really, really integral part of being a practicing doctor in the NHS.
Yeah, absolutely.
The whole lot, like a whole universe out there, like a lot of services that are offered. And as a student, usually, if you don't get the exposure, you will never know. So I think now it's going to be compulsory that students need to spend some time in general practice, which I found really good.
But I think that's fine, but we as practicing doctors should as well. I think all doctors, whether you're a surgical specialty or you're in a medical specialty, whatever, psychiatry, I think maybe a block in general practice as paid, someone who's actually doing a surgery for 4 months, like normal other placements happen. I do think that should be part of the curriculum.
Yeah, I do agree, to be honest. We will avoid some of the media bashing we get to
4-hour lunch breaks. I think I've said that so many times now.
Yeah, it's just like, do you do anything apart from calls and cuffs? Guess what? Yes, we do.
Yeah. And say, for example, someone is qualifying as a GP now. What advice could you give them to retain, because I know we have first 5, for example, to try and help the people within the first, graduates within the first 5 years of their GP qualification, to try and keep everyone together. What advice would you give those first 5 GPs regarding a career in general practice now that you're a way into it?
So what I would just say, it's very easily to get and feel isolated as a general practitioner once you qualify, because as a trainee you have that supportive network of your fellow trainees, of your trainers, of your TPDs. And once you qualify, sometimes you get that feel, you can very easily kind of isolate yourself and detach. So key thing is, exactly as you said, like getting to be part of your first 5 GP group in the area. Try to explore, give yourself time to think that it's just the beginning of my career. The CCT in general practice is not the end of your journey. It's actually just a start to develop what you actually want to do. Not necessarily that you started a salaried job or a partner job that you will always do the same 9 till 6 or 8 till 6, seeing patients and going home. There's not a problem doing that. That's the core of general practice. But try and think of what special interest would you like to add to your portfolio and your career. What do you see yourself doing in 5 or 10 years? Do you want to? Some would like to take some sort of the route of medical politics and going down and some would like sort of to take the idea of medical ethics and law and to take the route of like sort of do the clinical case reviews and things like that. Some would like dermatology, some would go down, and some would do the general practice day-to-day work and enjoy it So just give yourself time. That's my piece of advice. Don't think that the CCT is the end of the journey. It's actually just the beginning. Because we
Exactly.
have
Yeah.
needed 3 years to learn the core skills of being a general practitioner, but this
Yeah.
is just a start.
Yeah, absolutely. That's really, really good advice. I think a lot of people who are GPs qualified will really resonate with that. And you know, everyone you meet does different things and has different backgrounds in terms of how they, what skills they bring to general practice. And that's why it's so important that we all connect with each other and find out what makes each other tick. So we can, maybe something that someone else is doing will help, you know, yourself to make your career a bit more, you know, what's the word, colourful
Yeah.
and more satisfying.
And don't just settle for a week that you don't feel satisfied with.
Yeah,
See what you can do differently.
yeah,
Don't just settle for a routine week after week. Try to add a spark to it,
yeah,
however you can do that.
yeah. Oh, is there any? I mean, this has been really, really useful. I hope that everyone listening, you know, is feeling inspired by how much you've done. I don't think people appreciate that each diploma, each qualification takes a lot of hard work, a lot of effort. I mean, I remember you doing essays after essays for your PG cert, and
Because I didn't pass some of them first time, but it was.
but it's, you know, it's amazing. I mean, like, I don't remember the last time I wrote an essay, to be honest. You know, when I was in medical school, I think that was the last essay I wrote, was like in third year or
It was a challenge for me, especially that I didn't qualify. I'm not a UK graduate. Doing
yeah,
an academic essay to start with was a big challenge, but I kind of very grateful to lots of academic supervisors who guided me to be
yeah.
able to go through this and actually manage to pass it. But it was a challenge, let me put it this way.
But that's good to know that, you know, that there are people there to guide you and you're just not just left by yourself to do these essays and things, because, you know, there's a lot of self-learning, there's a lot of, you know, things you got to do by yourself, and just knowing what structure they want for the essays is really important so that you can pass. Um, and in terms of, you know, the coils, I mean, has that come back in, coils and implants back at the practice? Are you doing them
So
again now? Or?
implants, we're doing them back. For the coils, we're still not fully yet established on them because COVID hit in the middle of me getting the
Yeah,
final
yeah.
off, so I can't resume this yet. But we've been back with the implant, with the contraceptive implant fitting. It's about 18 months now, so we only stopped for like 4 months during COVID, and we re-implemented the service.
Yeah.
Yeah.
Fantastic. Is there anything else you would like to say, or any other nuggets of advice that you would like to
Yeah, it's
give people?
really lovely actually seeing you tonight, Zainab.
I know.
And I've actually kind of found my Instagram because
Yeah. And you've already got 80
I
followers.
didn't know I
Yay.
had an account actually that was done for you. So I think I'm going now to work a little bit more on it. And
Yeah, definitely. You know, just we should do this more often. We haven't seen each other for a while face to face, and I think that's something that we should plan. Um,
but
oh,
thank you very much for having me tonight.
thank you so much. I will end the live now and I'll save it. And then, yes, we will catch up soon. And thank you so much again for your advice and,
Thank
you
you
know,
for
just
having
being a guest on our show.
me.
Okay.
Okay, take
Oh,
care.
you too. Bye.
Bye. How do I end it?
Oh, I'll end the video.
Okay.
I'll end. Okay.